A woman who's told your labs are normal, but feels worse every month.
They're not going to listen to that patient say they're getting worse. They're going to think it's all in their head. They're going to probably gaslight them out the office because everything looks good.
Women being labeled as difficult patients when they keep asking questions and things like that.
You still want to at least educate your doctor, but not treat yourself. It's a beautiful thing when you're advocating for yourself, but I think it's even better when you find someone that you can trust, that's on the front lines, not just someone you read, someone you can see that's on the front lines doing this type of work on a daily basis to get those answers you need.
Keep asking questions, right? Advocating for yourself and ask questions.
Always.
We're going to play a game called Missed or Misunderstood. I think like the women listening are going to really feel this one in their bones because I'm going to give you symptoms or situations and you tell me, is the medical system missing this entirely or misunderstanding and why? First one, chronic fatigue in a 45-year-old woman. Missed or misunderstood?
It's misunderstood, definitely.
Anxiety that suddenly appears in midlife with no prior history. Missed or misunderstood?
Completely misunderstood.
Is that something you see regularly?
Every day. I just saw it before I got on this podcast. I lived through that perimenopause anxiety. Patients come and complain about it a lot, and then they end up on SSRIs and other medications, and they don't get better. It's definitely that neurotransmitters are impacted by our hormone, that production of serotonin, dopamine, norepinephrine by our hormone stabilization. So all day, every day, I'll see that. And that's why so many women get on these meds, right? When they don't need it.
Brain fog that gets blamed on perimenopause. Missed or misunderstood?
Missed. No one's thinking about that. No one's thinking of brain fog and hormones, really, standard medicine. So it's missed so many times.
A woman who's told your labs are normal, but feels worse every month. Missed or misunderstood?
Missed. Because they're not going to listen to that patient say they're getting worse. They're going to think it's all in their head. They're going to probably gaslight them out the office because everything looks good.
Good point. Joint pain that comes and goes and gets labeled as aging.
Oh, definitely misunderstood, because that joint pain, could be tick-borne diseases. Lyme disease can be autoimmune disease. And I just think they just miss it all the time.
A woman being prescribed antidepressants when she says, I don't feel like myself.
Misunderstood. It's so easy. That's the easy way out. That's the fast 15-minute doctor visit, easy resolution to someone with complex chronic symptoms.
That's a good point. I feel like women in midlife, there must be like an increase in being prescribed like SSRIs and everything.
Oh, definitely. Because as our hormones change, like I said, our neurotransmitters levels are impacted as well. So we will have a higher risk of those mood changes, but it's because it's simultaneously occurring with hormonal changes.
Lyme disease being thought of as rare or region specific.
Misunderstood, of course, because Lyme disease is everywhere. It's international. That's why my association is International Lyme and Associated Diseases Society. It's inner city. It's, rural areas. It's urban environments. It does not discriminate. It affects all different backgrounds, ages, mothers, perimenopausal, postmenopausal. It also can flare up after you get stress. So I have people who might go through puberty. They may have had Lyme as a kid and then their symptoms worsen. They're having more neurological changes, joint pain, aches, fatigue. When they hit 13, 14, when you hit your menstrual cycle, women can have worsening symptoms of that we are mentioning because their hormones are changing. postmenopausal, so it does fluctuate. You have that death in the family, you get another infection, and all of a sudden you're having these symptoms that you didn't have before. That's because Lyme disease has a waxing, waning course. I can't stress that enough to your audience. It's all over. It's misdiagnosed, and people are dying because of it.
Oh, so scary. Oh, this one's a favorite. Women being told it's just stress. Missed or misunderstood?
Oh, it's misunderstood. I mean, yes, we are beautiful creatures and we are going to have stress, right? But that's like someone saying it's all in your head. Something may be going on in your brain. There might be an inflammatory process happening in your head itself, but it's just not all in one area. So yeah, that's so sad and misunderstood. And I used to say that. Full disclosure, before I learned functional medicine and I was primary care, that would be my end all be all. That was my get you out the office fast.
Wow. So what was the thing that really shifted for you that made you want to find answers, like really set you on that journey to be curious?
I wish I had a great story for that. It was really boredom. I was looking on Craigslist for a couch. Okay. And I saw they had the classified section and I was like, let me look there. And the job said for doctors who think outside of the box. And I was like, I'm out the box. This is kind of cool. And it was a Lyme practice. And like I said before, I had never heard of Lyme disease. I never heard of functional medicine, but I just jumped in, and it was kind of right soon after residency. I'd only been working in standard family practice for a short period anyway, and it was no turning back. So as I learned, I started reflecting on my own life about all the times I've seen this situation, like even Lyme disease patients. When I was in residency, I had a provider tell me, oh, that patient's drug seeking, because it was a landscaper who kept coming back after getting one dose of doxycycline and still didn't feel well. They were like, don't give them any more antibiotics. That was probably my first chronic Lyme patient, but I didn't think anything about it. So when I jumped into this field, it was God. He led me there, because then I started seeing so many struggling people that were suffering for so long, and it was no turning back. And, that's really my story. I didn't have like a revelation one day that, oh, I definitely want to go. I was bored and I knew there was something greater that I was to give to this world versus just prescription medications,
And so glad you did, because no doubt you've helped so many people. So grateful for that. But I want to close with our final cue. And this one really gets under the skin of a lot of people. So, yeah, right. Women being labeled as difficult patients when they keep asking, questions and things like that. Missed or misunderstood?
That's definitely misunderstood a lot, and especially I always tease patients, right? It's a difference between asking questions or being Dr. Chat GPT or Google. Okay. We want everyone to advocate for themselves, but you still want to at least educate your doctor, but not treat yourself. Right. But I think it's a beautiful thing when you're advocating for yourself. But I think it's even better when you find someone that you can trust, that's on the front lines, not just someone you read, someone you can see that's on the front lines doing this type of work on a daily basis to get those answers you need. But I do encourage you to advocate for yourself, but I don't encourage you to use these AI tools as your provider.
Yes. Keep asking questions. Go see your doctor, talk to your doctor, get all your good information. Always go see your doctor, but keep asking questions, right? Advocating for yourself and ask questions.
Always.
Always.